Hi all, this is Dr. Vinodini, Pharmacology Department in Modern Academy of Learning. I'm here to discuss the management of medical emergencies in dental practice. So to start off with urgencies and emergencies. What are some urgencies? So urgencies are the conditions which actually does not pose any immediate threat to life of the patient. So what has to be done? Any urgency has to be quickly attended and so that prompt care, if it is being done to the patients, it can be prevented from becoming critical situation. Then emergency. What is an emergency? Actually, this poses a threat to the life of the patient. So immediate, urgent intervention has to be done immediately, and the patient has to be saved immediately. Any delay in this may cause severe harm to the patients, or sometimes death also can result. We'll just see what are the urgencies and emergencies that can occur during the dental practice or the medical practice. Fainting, urgencies are fainting, low blood sugar, that is hypoglycemia, seizures, asthma attacks, hyperventilation, and angina related chest pain issues, and mild allergic reactions. In emergencies, which need an urgent intervention, cardiac arrest, severe allergic reaction, that is anaphylaxis, then obstruction of the airway by blocking some dental materials or some other tests may go and block and cause obstruction of the airway. What are the different types of emergencies that can occur? Syncope due to multiple reasons, seizures, then respiratory due to respiratory problem, due to cardiovascular problem, uh, and sometimes drug related emergencies can also occur during the practice. First, we'll discuss about the management of syncope. So syncope is of different types. It based on the root cause. It may be a vasodepressor syncope, or it may be a postural or orthostatic hypotension due to the fall in blood pressure due to which has occurred during the posture, hypoglycemia due to low blood glucose level, or due to acute adrenal insufficiency. Any of these factors can lead to syncope, that is sudden fall of the patient in the clinic. So what is the reason or the physiology for this blackout that occurs during the syncope? Stress. The stress or the fear factor is the main thing which actually aggravates this syncope causes. So catecholamines, what occurs when a patient gets disturbed or when they have fear for any of the medical procedures or the dental procedures? So catecholamine get released. Catecholamines include our different types of adrenaline, noradrenaline, dopamine, dopamine. So all these catecholamines, predominantly adrenaline get released. Since adrenaline is getting released, it is causing peripheral vasodilation at the end. At the peripheries, there is vasodilation. So, and that leads to this preparation of action. This vasodilation actually prepares the patient for the syncope. Then it leads to subsequently, it leads to the absence of the muscular movement in the patient. So, what happens? The patient doesn't move. They just stand still or sit still, especially in dental. When they are sitting in a dental chair, they may sit still. So this finally leads to the drop in venous return, which is actually should return and the blood supply to the brain area is not being reached, and there is a severe drop in the venous return and cardiac output. All these things finally leads to the syndrome. Now we'll discuss about the triggering factors. What are the triggering factors that can actually lead to the syncope in a patient? Psychogenic, that is related to the mind of the patient, and non-psychogenic factors, that is the body of the patient. So based on the position or whatever the body is doing. So next, psychogenic factors, we have fright, that is anxiety. So the patient expect, especially dental chair, patient have dental phobia, dental chair, especially the positioning, the procedure, and the injection into the oral cavity. All this causes a fear in the patient. So this anticipate the patient actually anticipate pain in this patients. Then sudden unexpected during some procedure, sudden unexpected pain in the patient. may also trigger this. Then sight of blood in the dental instruments, whatever the syringe or the needle, whatever they are using, when they happen to see the blood and the drilling, they are doing if some blood oozes out, they happen when they spit out the blood. So when they happen to see the sight of blood, this again can lead to be a triggering factor. Unwanted news when they hear during the procedures. Also, sometimes it won't occur mostly, but still, when they actually being under procedure, when the doctors or the dentists are speaking, when they receive this unwanted news, sometimes also may lead to trigger the syndrome. Non-psychogenic factors or sitting patients, sitting position. Sitting in upright position may also lead to drain of the blood leading to syndrome. Hypoglycemia. Sometimes because of fear or because of time or something, the patient may skip a meal without not thinking about the seriousness and suddenly leading to the low blood glucose level in the patient. Again, that also can trigger the syncope in a patient. Hot and humid environments, when they travel in the hot environments, that also can lead to the can also be a positive factor for syndrome. And exhaustion. Exhaustion of this condition can also like, lead to this one of the triggering factor. Prevention is the first line of defense. If at all the patient is undergoing skill syncope, is getting syncope, how to recognize, how to find out the patient is undergoing syncope. So we have two zones actually, yellow zone and red zone. This yellow zone is the one where we can actually recognize the pre-syncope stages. So these are the symptoms that occur during the pre-syncope stages. By finding out carefully, monitoring these symptoms, we can actually find out the patient is going for syncope. So subjective effects. So the subjective effects actually includes the warmth. The patient feel warm or they may faint to some extent or nausea. Faint is not complete unconsciousness. They start fainting. They have a nauseating feeling. Objective types, they have Asian gray skin tone can be seen in the patient. So we can also be able to see. Not all the symptoms, well, most of the symptoms may be present in a patient. So objective type is diaphoresis. So extreme sweating, even on a well-maintained temperature, or since the patient is very or he is under the syndrome, they have this extreme sweating occurring in their body because of the hands become cold and clammy. So by touching and feeling, we can actually recognize this also. The vitals. When we check for the vitals of the patient, the heart rate increases. So sudden rapid rise in heart rate occurs and BP also start rising from the baseline. So if we are able to find most of the symptoms occurring in the patient, the best thing is stop the procedure. Immediately stop the procedure. Then again when patient will be entering the red zone, that is the clinical syncope is occurring. So this clinical syncope, when it is occurring, what are the symptoms that occurs? So we saw that during in the yellow zone, that is pre-syncopal stages, it tachycardia, increase in heart rate occurs. Whereas from tachycardia, it becomes bradycardia. The pulse also start becomes slow, weak, and threatening. So loss of consciousness. Pupillary dilation. Dilation of the pupils in a patient occurs and hypotension. Whereas pre-syncopal stage, we saw a rise in blood pressure, but here there is significant drop in blood pressure occurs and irregular gaspy breathing also occurs. Sometimes the patient may get convulsive movements also. Not always they get, sometimes they get. If cerebral hypoxia occurs, then the patient may get this convulsive movements. So when these symptoms occurs, we can find out that the patient has got the clinical syncope stage, immediately we have to treat the patient. So, what is the emergency management protocol? Once we know the patient has got syncope and they have fainted, stop the procedure. Immediately stop the procedure. Remove all the instruments from the area where the patient has fainted because they may get accidentally injured. So, remove all the instruments from the area where patient has fainted. So we have to assess the consciousness of the patient. So by shaking and shouting at the patient, we have to check whether the consciousness level of the patient. So activate, we have to, if there is an emergency when we are not able to, after doing all the first aid procedures, the needed things, we have to activate the emergency system, call for the help of the patient. So what is the emergency management protocol that we have to follow? Position. P stands for position, then circulation, A stands for the airway, and D stands for the drugs. So what are the management protocol? Now we are going to step one in the management position. So the position, the patient remain has to make in the supine position, but with the feet elevated. We can see that the feet is elevated here. This is called as Trendelenburg position. So with the supine with feet elevated is called as Trendelenburg position. So with this position, the gravity assists the flow of the blood. So this venous return increases the venous return. So which was decreased during the blackout stage. So it will be increased because of the gravity downwards. It will start flowing, and the venous return to the brain increases. So permanent neurological damage can be prevented. So next, protocol 2, that is step 2 is CAP. What is this CAP? This CAP stands for the circulation, airway and breathing. So circulation, how we are going to check the circulation? By checking the carotid pulse and also monitoring the blood pressure. So whether proper pulse is being maintained and the blood pressure is also maintained properly. The patient should not go for hypotension. If it is hypotension is also there, we have to check and we have to give the drugs accordingly. Then airway. Patent airway has to be maintained in a patent manner. How this can be done? By tilting the head with the chin up. By tilting the head, we can maintain the patent airway because if it is down, if the heads are down, it may cause tongue obstruction in the airway. So in order to prevent it, we have to perform the head tilt chin. Then breathing. So we have to monitor the breathing also by listening to by feeling the breathing. We have to check the breathing of the patient. And if at all the patient has wore any tight clothes and all or any tie collars or belts has been worn by the patient, that has to be removed or loosened immediately. Step 3 is definitive care. With basic interventions, what are the things that has to be done? Management and pharmacological. With the drugs, what are the drugs we have to give based on the symptoms of the patient? First is administer oxygen to the patient to ensure the proper breathing of the patient with the full face mask, and cool towel on the forehead of the patient to ensure again the circulation also getting enhanced. Then pharmacological interventions, that is drugs. So we saw that during the full syncope stage, patient has got this bradycardia. This persistent bradycardia can be treated by giving the drug, that is our atropine can be given. Atropine is an anticholinergic drug, a very definitive drug which can be used in the treatment of bradycardia. When bradycardia is not corrected, it may lead to atrioventricular block. So it should be given immediately, either IM or IV. So we should start with zero point 0.5 mg of atropine. It can go maximum of 3 mg. Then next is hypotension. So fall in blood pressure, even though we have corrected with the position and the brain has got the required supply, If persistent hypotension is there, methylprednisolone is a drug, adrenergic drug that has to be given to correct the hypotension. It's one of the drugs of choice in the treatment of hypotensive states. How we are going to administer methylprednisolone? 10 to 30 mg can be administered as an intramuscular injection can be given. Then hypoglycemia. If patient is conscious, we can give sugar. Some sugar source has to be given in the form of juice or in the form of soft drink or as chocolate also. Easily dissolvable chocolate can be given to the patient if the patient is conscious. If the patient is still unconscious, then we have to go for the IV glucose in the patient. When to call EMS, even after administering or managing the patient with all the management, drugs with the drugs, everything, if we are not able to, if the patient is not recovering within 15 to 20 minutes, then some other major problem is there. We have to check for this chest. What is this chest? This is the San Francisco syndrome code. We have to check for the CHF history, that is congestive heart failure history, hematocrit if it is less than 30, then ECG if it is abnormal, shortness of breath with systolic BP less than 90 mm. If it's any of this criteria, if this chest criteria is met, immediately we have to call EMS, that is emergency medical services has to be called to prevent any further damage. So with this, we have completed the treatment or the management of the syndrome. We'll see the other management of the other emergencies in the next part. Thank you.